Welcome to the Endpoint EpiTrax training series. My name is Jared Smolarkevich and I will be walking you through this module. Please feel free to contact me or another member of our team with any questions or feedback you may have after the presentation. At Endpoint, we are always looking for ways to support you even better, and your input and questions help us do just that. Understanding the various concepts that make up healthcare data builds on the fundamental concept of interoperability from the previous module. This presentation will cover the topic of healthcare data by asking, what are electronic health or medical records? What are electronic laboratory reports? And what is electronic case reporting? We will also look at how are reportable health conditions identified by public health agencies or PHAs? What the healthcare data workflow looks like as a whole? And how this all ties into the effective solutions EpiTrax provides for healthcare data. Let's begin by gaining a better understanding of electronic health records. Electronic health records, or EHR, are also sometimes referred to as electronic medical records, or EMR. This healthcare data refers to the electronic version of a patient's medical history. EHR data accumulates and is maintained by the patient's healthcare providers over time. An EHR may contain various types of healthcare data, which would be extremely difficult to update and track manually. Major benefits of compiling that data into an EHR include automated access to patient information and the ability to streamline each clinician's workflow. Handling patient data electronically also reduces errors and improves the accuracy and communication of that patient's information across providers and other healthcare entities. An EHR contains the real-time, patient-centered data needed to make important and timely healthcare decisions. Just imagine how strenuous it would be to keep track of all of your healthcare information without resources like an EHR. Electronic laboratory reports, or ELR, transmit digital laboratory data to state and local health departments. Just as with EHR, an ELR removes manual data entry, reducing errors or misinterpreting information on handwritten forms. An ELR also requires laboratories to always include essential lab data, which reduces the burden on public health agencies to need follow-up information later. Electronic case reporting, or ECR, is the automatic generation and transmission of case reports from EHR to PHA for review and action. Two pieces of information move back and forth during this process: the electronic case report, or ECR, and the reportability response, or RR. The first or initial ECR report, sometimes abbreviated EICR, moves from the EHR to the PHA. It contains information regarding the patient's encounter but is not final. This report may evolve as additional data is collected and the ECR is updated. The reportability response is the acknowledgement that is sent back to the EHR from the PHA confirming that the report was received and whether the patient's condition was reportable. The Reportable Conditions Knowledge Management System, also known as RCKMS, is the current authoritative decision support service that uses PHA rules to determine the reportability of healthcare data. Although not every jurisdiction uses RCKMS, it has significant advantages over alternative methods used in the past. More information about RCKMS can be found at www.rckms.org. Currently, there are over 170 reportable conditions tracked by public health agencies in the United States. The National Notifiable Diseases Surveillance System, or NNDSS, is a resource used in public health that maintains an up-to-date listing of all these conditions. Their searchable list of these conditions is available online at ndc.services.cdc.gov. With all the terms and resources involved in the healthcare data process, it can be helpful to see a visual reference of how they all work together in relation to one another. The entire healthcare data process starts with and is designed around the patient, who is defined as any person who visits a laboratory or clinical provider for assistance related to their healthcare. Patient healthcare data is used for various purposes and travels in many directions. This workflow diagram focuses on two of those routes, starting with when a patient interacts with a clinical or public health laboratory. These laboratories gather lab data from that patient related to their healthcare. Lab data is then transmitted from laboratory to PHA via an ELR. PHAs use the following types of reportable data to successfully determine the health of the population and its healthcare needs: treatment efficacy, morbidity rate, disease trends, pregnancy status, occupational information, and travel history. The second route we will look at, where healthcare data flows between the patient and PHA, is established when the patient interacts with a clinical healthcare provider. The provider is the person or facility who assists that patient with their healthcare needs. Patient healthcare data gathered by the provider becomes part of that patient's EHR. EHR data is then evaluated to determine the presence of any reportable conditions by a resource like RCKMS. When one or more reportable conditions are found, an ECR transmits the relevant data between provider and PHA. In this healthcare data workflow, an RR is sent back to the EHR from the PHA, as data is exchanged via the ECR. This also copies back to the PHA regarding the process. As you can see, managing healthcare data as a PHA is complex and overwhelming without powerful resources to streamline the process. Events like the COVID-19 pandemic vividly underscored the necessity of having all this data available to make timely healthcare decisions in ways tailored to each use case. Epitrax is able to import ECR data from electronic health records in ways that make sense to the PHAs who need it. Its customizable APIs can integrate external patient data seamlessly into the workflow. And there is even a portal for collecting non-standard laboratory reporting. In addition, the vast ELR configuration rules allow for next-level automation. Advantages also include the ability to handle any reportable conditions identified by public health jurisdictions. With this in mind, it's easy to see how Epitrax provides the practical solutions PHAs need to remain in compliance with healthcare data standards. This way, they can continue taking care of their communities. In summary, this module has covered how electronic health records, also called EHR or EMR, contain information on a patient's medical history. Electronic lab reports, or ELRs, transmit lab data to public health agencies, while electronic case reports, or ECRs, exchange healthcare data between PHA and provider. Healthcare entities utilize services like RCKMS to identify conditions that are reportable to public health. The healthcare data workflow diagram illustrates the relationships between these components as data flows from patient to PHA. Lastly, we discussed the features and benefits that make Epitrax the premier solution for those PHAs as they manage the healthcare data to effectively respond to the needs in their communities. We hope you found this presentation engaging and beneficial. Endpoint team members looking for additional resources related to this presentation and others in the Epitrax training series can find them by searching with the keywords Epitrax training on the Endpoint Company Wiki. Thank you for watching.